Diabetes is a condition in which the body does not properly process food for energy. The first mention of this disease dates back to ancient Egyptian texts from 1552 BC. Advancements in understanding the disease were slowly made over time, until insulin was discovered as a key treatment for diabetes in 1921. In 1982, this life-saving treatment became widely available to the public. 100 years after its discovery, access to insulin remains a problem for millions globally. This is largely due to low production of insulin by pharmaceutical companies and high cost to patients. The Open Insulin Project began in 2015 as part of a growing movement to address the rising cost of insulin. Open Insulin comprises a wide range of volunteer activists in community biology labs, including the Baltimore Underground Science Space, or BUGSS, and counterculture labs in Oakland, California. Their goal is to create an open-source, small-scale, community-centered model for producing and distributing insulin. This includes local laboratories as well as community pharmacies. So how might this work?
Hi, how can I help you today?
Good morning. I'd like to get my insulin prescription filled, and there's my insurance card.
Okay. Are you aware of your copay on this?
Boy, I don't know if I can afford this. Did you use my insurance?
I did use your insurance. Okay, let me see if there's something I can do. Hold
Thank
on.
you.
In the future, what if pharmacists worked with laboratory scientists to produce and dispense insulin? Open Insulin is already working to make this future a reality, and here's how we're doing it. First, we insert the human insulin gene into bacteria. The gene that is inserted into these bacteria allow them to produce the insulin protein. Once the insulin gene is in the bacteria, we grow them in a bioreactor that has the specific temperature and nutrients to allow them to replicate or make new copies of bacteria able to make insulin. At the bottom of the bioreactor, a magnetic stir bar spins and produces oxygen to help the bacteria grow. While the bacteria grow, insulin is released into the liquid called media. The insulin is then extracted from the media through a technique called fast protein liquid chromatography, or FPLC. In this process, the media containing the insulin is placed into a container called a column that is filled with a material that binds the insulin. As we wash the media away, we isolate the bound insulin for collection. The isolated insulin is collected into smaller samples through a device called a fraction collector. These samples are developed further into an injectable form of insulin safe for patient use. The bioreactor featured in this exhibit works for small-scale production. For community-scale production, we use larger bioreactors that will enable local laboratories and pharmacies to produce insulin on-site for patients at affordable prices.
Okay, you're all set. How's that?
That's much better. I can afford this. Thank you so much.
See you next time. Have a good day.
In the future, community labs may offer affordable alternatives to many medications needed by patients, allowing more people across the world to receive the care they need.